Hello, everyone. I think I may possibly waited a little bit too long. I see a couple of you. I wanted to do something different. Rochelle is actually in the middle of traveling, and so she will join us a little bit later. Our goal today was to kind of almost have like a town hall. Rochelle and I were trying to assess what are some of the topics that people were interested in hearing about, and kind of wanted to uh, find out who was listening and get some ideas from the audience and from you guys. And really, if you have or any of you wanted to present in the future, we're trying to kind of think about where should this um, GPMRR seminar goes. We didn't have a speaker lined up for today, but we decided that we would use this time to actually get to know who's attending and to get to know what directions or what are other things that people are interested um, in hearing. How I'm going to do this, because what I can do is promote whoever wants to speak to become a panelist. If you're interested in sharing your thoughts and how you've experienced these seminars, why they've been helpful, what do you want to see in the future? I'd love to hear from everyone who is on the call today, and kind of get some ideas or some direction. If you want to participate, just let me know. I think I can see you're muted.
Um, Good evening or
Good
good morning. I
evening.
don't know. From
Yeah.
here, it's actually evening. My name is Muji Bolajide Okwabode from Obafemi Awolowo University, Ile-Ife, Nigeria, and I am an undergraduate student researcher at Applied Artificial Intelligence and Research Robotics. So I would actually like this webinar to be around BCI with robotics and in medicine, because lately we've been seeing trend around let's say for example neural link, and yeah, I would actually love us to talk more on that aspect, because like this is actually like medicine is woven with physics, with with electronics and electrical. And of recent we saw the Nobel Prize winner, like we saw their work that they were that they were awarded for. So I would actually love us to talk about all those aspects. Thank you very much.
So Mujib, can you clarify? You mentioned PCI, but I didn't know what was that acronym.
Okay, BCI means like brain
BC.
computing.
Oh,
BCI, brain
BC. Oh,
computing
I'm
interface.
sorry. Yeah, sorry. I heard PCI.
Oh no,
So
no.
BCI, I know what that is, brain computing interfacing. Okay. So you wanted to talk a little bit more about brain computing interfacing. Are you specifically thinking about neuromodulation and some of the work around neuromodulation specific to any particular disease state, or
No, actually,
um,
just in
okay,
general, in general.
just in general. Okay, so brain computing interface. Okay, thank you. Anyone else would like to share? I think, go
Thank
ahead.
you. Hello,
Hi,
everyone.
Dr.
Thank you.
Kamalafi. How are you?
Yeah,
Good.
thank you, Michelle. Nice seeing you. It's a great job you are doing, and I've been joining. Well, I would like to see more practical aspects and systems that can be used in the third world. I know you do some work in Africa.
Mm-hmm.
Yes, so and the webinars we've been involved, it has gone round, but I think looking at systems that we can implement and
Okay.
also go on with collaborative work. So I think for us in Africa and in Nigeria, I don't think it's really not part of our practice as it is now.
Okay.
So the webinars have been useful. I think there's application in various areas of neuro rehabilitation. So I think the webinar should continue, but
Mm-hmm.
we would love to see more of areas where the ideas can be implemented.
Got it. So do you have any areas in mind? So being a neurologist, are you thinking systems that could be, I know that you work in a tertiary care hospital in Nigeria. Are you interested in things that could be implemented in the hospital, outside the hospital, in home? Can you clarify?
Yes, I think, well, from the little experience we have, systems that can be implemented at the home uh, uh, look like the way forward. There's a lot of deficiency in health personnel. So with a lot of immigration, so most of the personnel are not there. And then systems that will not need maybe alternative power sources, battery operated system, something that will be easy to implement in the house will be better than in the hospital.
So when you say alternative power sources or maybe leverage, okay, go ahead.
Or solar. Yes.
Oh, okay, got it. Or other types of sources. Maybe there's a body of research. Actually, my student Erica, she's here. She's doing some work in haptic communication and kind of trying to think around how caregivers and your community can help you exercise. So maybe Erica, I could put you on the spot, but maybe you could be a speaker in the future.
Yeah, definitely.
You want to share just a little bit about what you're doing?
Yeah, so my project is using the TheraDrive robots, which I'm sure anybody who's been attending these seminars has heard about, but they're 1 degree of freedom robots that are designed to be low cost for different therapy games for the upper limb, primarily post-stroke, but we've used them with other populations. So my project is pairing 2 of these devices together and creating a bidirectional haptic feedback. So you can think of it as like a spring damper between the 2 robots. Sometimes I describe it as a rubber band between the 2 robots. We put 1 person on each robot, and that allows them to have this kind of haptic interaction that they can exchange forces. We can pair 2 people to play a game together. So whether that's a therapist with a patient with their caregiver, etc. With the idea being that people post-stroke can learn from someone who's healthy and that we can use controls to kind of create optimal interactions for them.
Well, so I think that means Erica will be creating a space for you to share your research work in the future. Because this type of haptic dyad situation that Erica is researching, I think has potential for community-based support and for um, other caregivers, like she mentioned, to support each other, or their even their family members might be able to support them in terms of the therapy. So it could be possibly at home, but I would say, ideally maybe in the primary care settings that are in the community as well. So definitely we could explore that topic a little bit more as well. Any other um, areas or in this kind of saying when you say Dr. Kamalafi, you mentioned application that could be used in third and developing countries and in Nigeria specifically. Are you thinking of anything in mind that you've heard about that you would want us to kind of see if we can get a speaker?
Yes, I think from some of the webinars I've attended, like I think the way to go would be home-based rehabilitation, just like the work Erica is doing. And I think now it's very challenging for patients to access tertiary care because of distance, cost of transportation. So for sort of a tele based systems, remote rehabilitation. So could have more of that. I think some developing countries, maybe India, people that have experience with such systems, and
Mhm.
then possibly the webinar can grow into collaborations. I know you were in Ghana. Was it last year? You were
This
in Ghana.
year earlier.
Yes. So if there could be collaboration and hands-on too later. So um, I would like to see more of such. So thank you.
That's good. So essentially, you're saying if there are people who are doing this kind of work or are attending the seminar, that identifying yourself as a potential collaborator to kind of work with someone, either a clinician or another engineer that's located in one of these resource constrained settings, this could definitely be an ideal forum to announce yourself, and then we could kind of try to set that up. It could be in a sense that there is no rule. One of the key things about this seminar that is a little bit different from other webinars is that we really are interested in both perspectives. We realize that these problems in rehabilitation and neurorehabilitation, in medicine, and cannot be solved just by engineers. Engineers need to be working in very close contact with clinicians. And one of our tendency is to always have clinical input and engineering input at these webinars. So in a sense, I think we also want to facilitate those connections as well, like you mentioned, Dr. Kamalafi, in creating a nice connection between possibly a clinician in, like yourself in Nigeria, with someone who might be working in a different country, who are kind of looking into these things, or maybe you have a product that you've been investigating and you want to try to apply it in a place in Africa. This could definitely be an ideal place. I think what we could do is, if you have something that you're working on and you want to, share about it, in kind of like, maybe if you don't actively have a clinician right now, we can try to make a space for that. Um, what we're trying to do is to really push engineers and push clinicians to be comfortable working with each other, and push engineers to actually, make those clinical connections when they're designing and developing and implementing these systems. So yeah, maybe that could be a potential webinar in the future around this idea of creating collaborative teams, or if people are interested in going into breakout rooms, if we can, and talk through some of these issues. Any other comments? Because I heard tele-rehab, I heard more discussion on home-based rehab systems. I heard more applications that take the research, maybe from the research lab into kind of an implementation setting. So Oscar, you can go ahead and unmute yourself and speak.
Hello, Professor Johnson. First of all, I'm sorry I cannot turn on my video because I am on the bus.
No problem.
So I'm Ozgur Gaydogan. I'm attending from Osaka University. I'm working as a research assistant in medical faculty. I mostly work on developing a BCI system for paralyzed patients to enable them to control robotic arms. And then my mostly undergrad and master's research based work on exoskeletal rehabilitation robots for elderly patients and stroke patients. So yeah, so this I would like to be a panelist in the future. And I would
No,
like
yeah, this would be
I,
great. So I think because you say you're working on DCI, and that was what Majid wanted to hear about. So maybe you could definitely be a panelist. Can you send me Osgur, or put it in the chat so we all know how to reach out to you, and so we can kind of put you on the agenda?
Sure, of course. And also, I would like to hear more about personalized rehabilitation
Personalized,
and
okay.
rehabilitation.
Rehab and tele-rehab, okay.
Yes, thanks so much. I will put my email on chat.
And are you working with a clinician, Osgur? And if so, can you tell us a little bit about that collaboration? And would you be able to share both from your perspective as an engineer and with your clinical collaborator in a future seminar?
Sure, yes, I'm working with clinicians because in my laboratory we work with engineers and medical students and medical professors. So we conduct patient trials in the hospital.
Oh,
so
okay.
I think I can conduct with my professor, and I think we can join maybe together.
Yes,
and we can mention with engineering perspective and medical perspective.
That would be great. Actually, that's ideally the type of webinar that we're wanting to put on, is where we get both perspectives, because I think, and then we acknowledge the challenges that are occurring in terms of real world implementation of the engineering systems that you're developing. So yes, can you also put the lab that you're with and some of the details so that when I reply to you, I'll remember?
Thank you so much.
And
I
then
appreciate it.
I'll follow up. Yeah. Thank you for that. Anyone else want to share what they're interested in, or whether they would the work that they're doing, and whether they would be interested in being a speaker?
This is something that I'm interested in hearing. It would be interesting to see from clinicians more of the standard of care, and what gaps they see as existing, and how some maybe even low-hanging fruit in terms of technology that could be used to assess and fix those issues.
Okay. Okay. Would you just to extend what you mentioned, Erica, would you want to understand what type of assistive technology that has been developed in country, if the clinician has already kind of been doing some of that work?
Yeah, definitely. I mean, I think hearing about, what is standard of care that most patients are receiving, where do they see as kind of their next steps and what they're trying to implement, even if it's maybe in a case study or a lower population group, I think that would be really interesting.
Okay. I'm just taking notes. I know that we're recording, but I want to take notes in real time as well. Anyone else who want to share about their work, or want to kind of say some of the things that they're interested in us featuring in the future? Don't be shy. Anyone else? If you've joined after the fact, because I noticed there are some new people on the call. What we're trying to do what's unusual this time around is we're having kind of basically like a town meeting. And what we're trying to do is really get a sense of what type of topics that people want to hear about, And also if people want to be speakers. So, and what you've been benefiting from in terms of this webinar, if you just joined us and you would like to be promoted to the panel, just let me know. If you like to speak and you don't want to be promoted, that's okay. We can still allow you to talk in the webinar, even though you don't want to be promoted to panel. So please raise your hand if you want to share something or be promoted to the panel. I know there are several people who joined later. Any other thoughts? Valerie, okay. Okay, 1 second. Let me I'm gonna promote you to panel, and then you can share. If you'll get an email. You can accept the invitation, and then you would be promoted to panel. Okay, perfect. So go ahead and unmute yourself, and then you can speak and share. Please introduce yourself so we get to know who's asking and what zone in the world that you're from.
Yeah, hello everyone. I'm Valerie Labu, and I'm a physical therapist by profession and neuroscientist. I'm from Cameroon, and I have a background in neurological rehabilitation and also in industry, like both clinical and industry-wise. So actually, I just like to add something to what have been said in terms of this type of conference that is upcoming, and the importance of having the clinical, both the engineering and the clinical vision toward rehabilitation devices. Because from my experience, I've been lucky to be both on both sides in my career. And one of the things I noticed that sometimes the expectations of the clinicians are not met, like from the clinical standpoint of view by the engineering team, and that create a conflict. So you can have a very technically designed, well-designed equipment, robot or whatever, but at the end of the day, from the technical point, it's like kind of perfect, but it gets up not being integrated perfectly in the clinic just because, from my point of view, clinicians have not been involved in the conception the conception of the device, and then end up like not making it quite usable. And also the feedback that the clinician does, because at the end of the day, one thing that is important is that the clinician becomes the middle person between the engineer and the patients. At the end of the day, he's the one using the device on the day-to-day basis. So, and a particular input from the clinicians working hand in hand with the engineering team, it's very important to make sure that we have a device that really addresses the patient needs, but also can be integrated in the routine of the clinicians, because all clinicians in neurological rehabilitation has a routine. And if the device is not designed in such a way that can be easily integrated in their routine, they may end up having it in their lab or in their facility, but not been using it. So that would be my point at this point.
Yeah, that's an important point. You're saying essentially that why people may abandon some of these technical devices is if there's not enough thought into how it fits into the clinical setting, whatever that setting is, or the patient setting. And so it could be a nice device, very cool, but not being used because of that. No, that's a great point. And I found that to be the case in my observations as well.
Yeah.
Do you, couple of things you said that is interesting. It gets to something that Erica mentioned about standard of care. Clinical routine. I know when we think globally, clinical routines might differ from, if you're in the US versus if you're Nigeria versus Cameroon. Can you talk a little bit more about if there is like a standard in clinical routine, and how do we as engineers find out, or should we bring some folks to tell us about what these routines are and what are some of the common sticking points that where engineering design might fail when you're trying to implement them?
I'm not really sure if I got the question quite right, but I'll try to give an answer. From the standpoint of view of the standard of care, actually, I would say it really would vary from, like, you have institutional standards that may vary from what is applied in a country or in a particular setting. But what I may say about it is also the standards sometimes also apply to the, let me say, the qualification of the therapist, because some would not have just the qualification to reach a certain standard of care and would limit themselves to certain things. But now, when it comes to the interaction with the robotic in integration in the standard of care, I think there's also a cultural part that need to be taken in consideration.
Mm-hmm.
And how would I put it? When I mean the cultural part, some type of the material that is used to design the how the robots look, because I've been in situation where some robotic device were looking frightening for patients.
That's actually a wonderful point. And maybe given your experience as a physical therapist, maybe we can get you to give a talk around some of these pain points. That's where I was getting at. If there could be a useful webinar on common pitfalls that, where engineering devices have failed and on what level they have failed and because of what. And your example of, hey, this is an interesting the device, but it was scary, and as a clinician you're like, I don't want that to come next to my patient. Some things like those we may not always think about as engineers, but they may be important to you as a clinician, and it might be a worthy seminar to hear about.
Yeah, definitely. I would like to discuss that. Yeah, I would like to be part of like giving some insight into that. Yeah, definitely, it's something I would like to do.
Okay, that's a potential seminar idea there.
Yeah, maybe I may add like one last thing before I mute myself. It would be still in the interaction, the clinician. Let me say the clinician in the first time, the clinician engineer interaction in the conceptual framework of the designing of the robot, and also somehow the integration of the patient's view into that, because at the end of the day, as I was saying, just in the same example, in some case, the clinician might not be the problem. He may even like to use the robot, but the patient would be refractory to it. And sometimes just because the patient is not educated enough about it, and also sometimes the approach of the clinician introducing the robot to the patient is wrong, making it refractory to the patient. And sometimes the fact that, for example, the size or whatever the size of the robot, how is it is being powered depending on the environment where it would be basically be used. For example, in low and middle income countries, a lot of what is happening is that some of these robots, the way they are powered in the term of autonomy and the energy supply is not always consistent, end up having a robot that is very cool the first session and that ends up not being able to be used on the long run. So these are some of the considerations that need to be taken in consideration, mainly when it comes to integrating the robotics that is energy powered in low and middle income country, the power supply of the robot, the consistency, making sure that that part is taken care of to make sure that it's consistently used. It's important, because I would take a very simple case. So once again, in my personal situation, I've been in a situation where you have used a robotic device on a patient, they are overwhelmed, and the next time they come, there's no energy supply in the hospital, and they get up being disappointed 2-3 times, and you just feel that they're disappointed, they don't want, they fall from really high hopes, but not just because the therapist doesn't want to use the device, but he's not just able to use it because of the shortage of energy. So taking that into consideration in some of those countries would be something I think would be very important as well.
It's very, 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 very good observation in a sense that you're also managing expectations. And if the device is not robust to these types of common issues that might be facing, hospitals in low and middle income country, then it, even though you may have faith in the device, then the patients, you're saying, have lost faith in you having faith in the device and also lost faith in the device. So I think that's a psychosocial point that I think is important that you made that point. That's an important observation. Yeah.
Thank you.
Thank you. Anyone else want to either comment or share a potential seminar idea or a topic that you would like to hear or have us kind of present in the GPMR or seminar, or share why any other ideas or what you're doing and what you're working on? Just raise your hand if you're not already on the panel, and I can allow you to talk or promote you to the panel. And if when you're sharing, if you could introduce yourself so we know where in the world are you. Anyone else? Definitely, these have been some great suggestions so far. Anyone else would like to share? Ad Adams, I'm going to put you on the spot from Ghana. Are you here? I don't know if he's listening. I was going to put him on the spot. Laura, haven't so I know, so Laura, are you willing to talk through some of the things that you guys are working on? Nope. If you want to talk, just let me know by raising your hand, because I can't, and then I can promote you or allow you to talk. Anyone else? It's been a good discussion.
There's a question in the Q&A or comment.
In the chat? Oh.
Q&A question.
Oh, okay. I don't see the Q&A. I did see someone saying, I would like to invite resource persons to Nigeria for hands-on skill. Can we agree with Nigerian? Can you explain what that means? Are you wanting the person, do you want kind of a conference there or some type of workshop in Nigeria, or you want someone from Nigeria to speak in the webinar regarding resources in Nigeria? The person who shared that Q&A, let me know, or put it in the chat. That would be helpful. Like what do you mean by resource persons? Are we bringing in people to talk on the webinar, or are you wanting to organize something in Nigeria that you would invite us to come to? It's not clear. Anyone else want to share? One of the topics that oh, Laura, did you accepted the promotion to panel? Did you want to share, unmute and share, or Ad Adams? No. One of the ideas that was mentioned was telerehabilitation, and I kind of want to sit there for a little while because you could go into many directions with telerehab. But then it's also telemedicine, and in this particular area, the reason for having the medicine area in the webinar was to identify that sometimes the vehicle through which technology can support might be doesn't have to be robotic. You know, it could be VR, it could be other types of technology. Can we maybe unpack a little bit about what aspect of telerehabilitation or telemedicine or telehealth you'd be interested in hearing about? I know a couple of you mentioned that. Unmute and share.
Mm, uh, if I hope you don't mind if I add
No,
something.
go ahead. Go ahead. Everyone's being pretty quiet.
Okay. Yeah, for me, I think telerehabilitation has actually a very, very, very important potential, mainly if we still have to focus on low and middle income country. And I think telerehabilitation based, everything that will be based on cell phone, like mostly Android powered cell phone, it would have a very, very powerful penetration because um, uh, evidence have shown that like almost everybody in those countries holds a cell phone, a powered Android cell phone, and using it in terms of evaluation, follow-up, education would be very interesting. So for me, some discussion towards that direction, like evaluation, distance evaluation of a patient, like helping in the diagnosis, maybe AI-assisted evaluation through telerehabilitation will be very interesting to discuss. Like there are some few softwares that can be used in that regard. And follow-up of the patient, like constant report and collection of data would be interesting so that you can have a follow-up of the patient in that direction. And lastly, educational part so that the patient through telerehabilitation like service, I don't know, platform or whatever, the patient may have in the time he is not having access to the patient to educational material that would help him follow or keep up in track with his rehabilitation.
Got it.
Those
So
direction would be.
got it. That's excellent. So you would like to see a couple of, maybe invite some speakers who are speaking about use of cellular technology to enable, I hear, education, evaluation, and monitoring.
Correct.
And so if people are using mHealth technologies in those ways, then we could invite some of those speakers to the panel.
Yeah, definitely. I think that's something that would really have a lot of people might be interested in. Yeah.
No, that's a good suggestion. And if any one of you know someone who's specifically working in that direction, let us know, and we can try to see if they're interested in speaking to the webinar. You mentioned, Valerie, you mentioned specifically Android. Is there a reason why it's not just a general smartphone, but that you mentioned Android? Is it because iPhones are too expensive for most
Correct.
people? Okay.
Correct. In those settings, a lot of people might not afford an Android phone for two reasons. Not only they are expensive for the average population there, and some of the software are paid, while in Android they are cheap. They are free most of the time. They are open sources. So apart from, because the most of the population, when they decide to afford a phone or to purchase a phone, they take all that in consideration, not only the health part, but what other benefit they can have from the phone. And Android for now is the one that gives the most flexibility, cost-wise and technical-wise, like in terms of accessibility of other functionalities. Yeah.
So kind of having some people who have leveraged Android and maybe been doing some user studies on telerehab that could be applied, or maybe they already are in Africa and we can identify some of those speakers. The other, speaking of tele-rehab, M-health is, a big buzzword in many ways, mobile health, which is kind of in this area of using Android and smart tablets, etc. Is there, I know there are some work on accelerometry-based monitoring of stroke survivors or other people while in their living environment. Is that of interest? Because that's potentially kind of like a little bit of kind of it's not necessarily a brand new area, but it's a potential area that kind of gives access, as well as maybe more in markerless estimation or capture of people doing activities, which I think you got to, Valerie. Is that a potential area of interest, is to kind of delve a little bit more into M-health applications like the use of low-cost monitoring systems?
Yes, definitely, yeah, because in my personal experience with stroke patients, I've been using somehow effectively. I've not published anything, but it's like made on practice observation. But low cost, for example, wearable device like watches, like wearable watch to monitor the patient mobility throughout the day, the quality of sleep, have been proved to be very effective in readjusting my treatment with the patient. For example, like I had this case of patients that I was encouraging to like work, uh, having some working throughout the day they're not coming for therapy. And then I just make sure that they had the device, the watch on their hands. And when I took it, when they came to the office and I took it, I just connected to the device. I just noticed that they were sitting all day long. And
Got
so
it.
we adjust the way, so that would be an area of interest in terms of like we're using wearable, low-cost wearable device to help the therapist in decision making and monitoring the patient in helping in decision or readjustment of the therapy. So yeah, definitely that would make a point. That would be very, I think that it's an area that would have a lot of interest to therapists, knowing what their patients are doing when they are not with them.
Okay, that's fair. There's also another trend that is happening in terms of what we call electronic medical records. And I'm not aware of what is the standard use of electronic medical records in places out, I'm outside of the United States. Is that of interest? Because there's a big deal now in terms of harnessing the data from patients, especially the electronic data, to try to do a better job in terms of preventative medicine. Is that an area that that anyone's interested in, or maybe fundamentally, if EMRs or electronic medical record is not a thing, is that something that would be an area of where AI or technology can, if you're interested in hearing more about that area? Anyone?
Yeah, thank you. I think it should be an area of interest,
Okay.
although not widely available. Just a few centers have electronic medical records, but I think most institutions are trying to scale up to that. So that gives access to a lot of data for patient assessment and follow-up and how they are responding to rehab.
Got it. So something around the technology around, because then it's funny that that can also enable definitely rehab, but also devices as well. So if there's a way where devices can locally push information to a cloud that could then rest in someone's electronic medical record, then that also supports the entire infrastructure of rehab and being able to adjust decisions in terms of treatment of patients as they move forward. So we could try to identify some speakers that could provide some either things that could implement or just in more knowledge on how this feature could be mapped into into low and middle income countries in a cost-effective way. You know what I mean? Because I think there are some infrastructure issues that are probably things that need to be dealt with, but there could be also some innovative things that people are doing in terms of electronic medical records that could be of use. Any last minute thoughts and any last minute thoughts or okay, there's another question in the chat. I'll speak out loud about it to everyone. I'm a physiotherapist in Nigeria and will be interested in learning from any seminars or workshops on neuro rehab robotics. I was privileged to be a part of the Pulse project, but will also like to improve my skills. Okay, great. I think that's cool. Yes, we will continue to have more neuro rehab robotic seminars as well, and trying to mix it up and still kind of have the the hardware parts, but then also additional topics that are related to this issue, to the issues that people have brought up. So yes, I'm glad. Thank you for attending, and I definitely think we can identify additional topics to be shared. Is there an interest in exoskeletons? I know the challenge with exoskeletons have been their expense at this point. Is there interested in kind of hearing from people using virtual reality for exoskeletons or trying to get low-cost exoskeletons?
I was
Yes,
thinking it.
Okay, there are a couple
I,
people. Go ahead, Dr.
the
Malcolm.
area of interest, yes, as well, virtual reality to be low cost. So there's been some work on virtual reality. So to be interesting to have more webinars on virtual reality
Okay.
and exoskeleton too is another area.
Oscar, then Ad Adams. I think Oscar, you wanted to say something, and then Ad Adams.
Yes, I work in exoskeleton rehabilitation, and I would like to learn more about personalized solutions.
Okay, personalized solution. Oh, great, yeah. Ad Adams, go ahead. I saw your hand. Ad Adams, you can unmute and speak. Hello? We can't hear you, but if you unmute and speak. I don't know if you're speaking because we can't hear you. If you're having trouble with your mic, you can go ahead and type something in the chat, and then we can try to respond to what you type in the chat. But we couldn't hear you. All right, we're getting to the end of the seminar. Dr. Mendonça just joined us. I know she was traveling, but we've had a very productive seminar, actually. There were a lot of topics that came up, a lot of ideas, and then even some folks who could do seminars. And so that's exciting. And we'll follow up with those of you who had specific suggestions. So if you've given a specific suggestion and you're aware of a potential speaker who could be invited, please just shoot me an email or shoot Rochelle an email about it. For sure, Osgore, we'll try to get you in the circulation to talk through BCI, neuro BCI that you're doing. And then Valerie, you mentioned some of your work. I think crafting a seminar on kind of like on what are some key pitfalls to avoid in terms of and some key pitfalls or some key areas to emphasize when we're looking at collaborative designing with clinicians, the patient, and the device that you're developing. So just so I don't forget anything, I heard AI as an interesting area, brain computing interface, which is kind of large, but we could do neuro BCI, but we could also do neuromodulation based BCI. We heard personalized rehab and telemedicine. We heard providing some applications in mHealth, maybe Android based assessment, education, and diagnostics. We also heard the idea of exploring wearable devices, exoskeletons for mobility. Someone mentioned also for sleep, which I think is really interesting as well. And then supporting decision making, of course, exoskeletons and other types of rehabilitation robotics, and also virtual reality. And then I think Dr. Kamalafi's point about having some applications that might be able to be transferred, and then maybe even doing a seminar where people may be able to create like some opportunity to actually create or develop some collaboration. So thank you, everyone. It's 11:59. I want to respect your time. Thank you for joining. Thank you for sticking around. If you have any questions and we didn't get to you, you have my email. I'll throw it in the chat again. Please email them to me, and we will try and Mujib said this is his first webinar. Thank you for attending, Mujib. So you say, is this Mujib, if it's your first webinar and you want to hear about the upcoming, this webinar, just to give you guys an idea, this link is always going to be the same link. So we've kind of changed the platform where we would have a different Zoom link every time. This link that you use to join this webinar will always stay the same. What we typically do is, if we have a speaker ahead of time, we will send out the information about who's coming to speak. And if we're having kind of a town hall, sometimes we'll get that out there ahead of time. Today, we didn't. We just kind of hope that folks would join, and then we would just kind of have this town hall gathering, which we did today. So thanks again, and feel free to drop stuff in the chat if you would like us to follow up with you about anything in particular. Thanks again, everyone. See you next
month.
month.
Yep, next month on third Wednesday.
On the third Wednesday next month, which is the 20th. And we'll send out the information about who our speaker will be at that time. Thanks again, everyone. Take care.